Hello everyone, my name is Aki Kene. I'm going to be discussing the Affordable Care Act today. We are going to be looking at several topics today. We'll look at the status of the newly enrolled or the newly covered. We're also going to look at what the exchange is or different states' approach towards the Affordable Care Act and the impact of the Affordable Care Act, whether good or bad. So as of March 2020, 71.6 million individuals are enrolled in Medicaid or the Child Health Plus. Of the enrollment, 81.2% were newly eligible individuals and entitled to newly eligible enhanced federal matching. Enrollment increased by 14 million among the 49 states, reporting both decline, a 24.7% increase over the baseline. States that expanded Medicaid to cover the newly adult group showed a larger growth in enrollment between July and September 2013 and March 2020. Now we're also going to look at some other services and certain group that the Affordable Care Act cover. We are going to specifically look at women preventative health services. For example, birth control or counseling, well women visits, or breast and cervical cancer screening, prenatal care, etc. An estimated 58 million women with private health insurance currently benefit from this preventive service provision. For example, in March 2022, 38 states and Washington, D.C. adopted Medicaid expansion, which connected people to coverage and improve health outcome for women of color and families. What are the exchange? A health exchange, a health insurance exchange, otherwise known as insurance marketplace, is a comparison shopping area for health insurance. It is a place private health insurance companies list their health plan with the exchange, and people comparison shop on the exchange from among the available health plan listing. Through this exchange, people can obtain premium subsidy and cost sharing reduction, which serve to reduce premium and out-of-pocket costs for millions of eligible enrollees. So now the next thing we're going to look at, we're also going to look at the different state approach. So states have the option to create their own exchange or rely on federal government to create an exchange for them. Some states have hybrid exchanges that are either a partnership between the state and federal government or a state-run exchange that uses the federal government platform. However, some states have used the same exchange platform ever since the exchanges debuted in the fall of 2013, while others have changed their approach over time. Let's take for an example. Most recently, in the fall of 2021, three states, Maine, Kentucky, and New Mexico, transitioned from state-run exchange to their own healthcare.gov platform to state-owned exchange with their own platform, with their own exchange platform. Now, we also want to look at the impact of the ACA. Has it been good or bad? The ACA provides coverage to more than 14.5 million people in 2022 during open enrollment. The ACA provides coverage to individuals who are covered by their parents' insurance to remain covered until age 26. A good thing. This extended coverage is helping countless high school and college graduates continue their parents' plan until they buy their own health care plan. Most importantly, people cannot be denied coverage due to pre-existing condition. That is a gain. Enrollment through ACA, the marketplace, account for nearly half of insurance gain and help in large part by premium assistance. We do have references here that you can look at for further information. Thank you.
Medicaid was mainly introduced to provide healthcare coverage to many individuals that may experience low income levels. Even though Medicaid is funded and administered by both federal and state governments, the states may be able to set their own eligibility requirements as well. This is mainly because the federal government may provide the core rules that the Medicaid program should follow, but each state may also have the opportunity to make its own rules. Even though the states may be able to develop their own plans and changes to their state's Medicaid programs, the changes have to be approved by the Centers of Medicare and Medicaid Services. If an individual's income levels fall within a specific range of the federal poverty line, they are most likely to be eligible to enroll to receive Medicaid coverage. In most cases, individuals that are eligible to receive Medicaid can be classified as low-income individuals and their family members, pregnant women, children, elderly individuals, and individuals with disabilities. Medicaid mainly covers services such as doctor visits, inpatient and outpatient services, mental health services, prenatal care, preventative care, and many more. Medicaid may also have the capability of providing services such as dental, vision, home and community-based services, prescription drugs, laboratory and X-ray services, and many more. Affordable Care Act was primarily introduced in 2010. Due to the Affordable Care Act, many individuals had the chance to gain health insurance coverage for an affordable price. The Affordable Care Act also expanded the availability and access to preventative care, mental health services, pre-existing condition care, and many more services. Many low-income individuals and their families are eligible to enroll to receive affordable health insurance through the Affordable Care Act. The Affordable Care Act also lets dependent children stay on their parents' health insurance till they turn 26 years old. The Affordable Care Act mainly provides health insurance to many low-income individuals and their families, which help to lower the uninsured rates in the United States. Many individuals face challenges when trying to access quality and affordable healthcare. This is mainly because many individuals may not have health insurance, which make it hard for them to receive the proper care and treatment they may need. The Medicaid and the Affordable Care Act may have given some individuals the opportunity to get the proper health care they may need. The Affordable Care Act is primarily an expansion of Medicaid. They both provide health care coverage to low-income families and many more vulnerable individuals. This may also help to reduce the number of uninsured individuals and provide many individuals with affordable health insurance. Findings have suggested that the Affordable Care Act may have expanded Medicaid eligibility to 180% when looking at the federal poverty level. Modified Medicaid eligibility encouraged many low-income individuals to enroll to get health insurance, or they would have to face a penalty. Allowed dependent children to remain on their parents' health insurance till they are 26. Medicaid works together with Affordable Care Act guidelines when providing health insurance to low-income individuals. The monthly premiums may differ from one individual to another. This is mainly because the monthly premiums are based on the individual's income levels. In conclusion, the Affordable Care Act may be a good law that was introduced to many individuals who live in the United States. The Affordable Care Act may have given many individuals who receive affordable health insurance, which may result in many individuals being able to access quality and affordable health care. Findings have shown that the affordable health care may have shown the importance of obtaining health insurance, such as Medicaid, to many low-income individuals and expanded Medicaid access in rural areas. Due to the Affordable Care Act, many individuals were able to enroll in health insurance programs, which may have aided them with getting the proper care and treatment in a timely manner.
Group Project: Patient Protection and Affordable Care Act after 2016. Daniel Silva, HCAD 620, Professor Andrew Holberg. February 28, 2023. Changes to the ACA after 2016 U.S. elections. After the 2016 U.S. elections, President Trump stated that the best thing to do would be to let the Affordable Care Act explode. He directed federal agencies to use their administrative powers to begin dismantling the Affordable Care Act to the maximum extent permitted by law. For the next 4 years, his administration took steps to sabotage the ACA by destabilizing private insurance markets and or reversing the law's historic gains in health coverage. What variables are in play in the political debate over the impact of the ACA on cost, access, and quality of care? The major outcomes of the actions undermining the Affordable Care Act of the Trump administrations incorporate aspects such as ending the ACA's expansion of Medicaid, ending or undermining various protections for the people with pre-existing conditions, sharply cutting marketplace financial assistance, and weakening or eliminating the federal role in promoting access to coverage. All of these things were all different variables that were in play over the political debate of the impact of ACH on cost, access, and quality of care. They were all implemented systematically with the goal of exploding or dismantling the ACA after 2016 election. What are some of the key challenges facing state and national policymakers given the current status? The two main challenges facing state and national policymakers. The first one on the national level is the federal individual mandate. As a result of the Trump administration sabotaging the ACH, they prevented the IRS from using tools to enforce the individual responsibility provision of the ACA. This allowed for U.S. residents to file a silent return without stating whether or not they had healthcare coverage, and ultimately they were not fined by the IRS. This then reduced the number of people who actually signed up for ACA because there was not a threat for a fine for not being covered. The next challenges facing policymakers were the different attempts by states to modify the ACA Medicaid waivers. This was supported by the Trump administration, which agreed to consider Medicaid waiver proposals from different states that would make it harder for Medicaid beneficiaries to get affordable care and ultimately increasing the number of uninsured in the United States. On balance, has the ACA been good or bad law? Provide clear, fact-based, non-emotional justification for my conclusion. It is clear to see the different benefits of the ACH in this image above. We can see the different aspects of improving quality, lowering healthcare costs, access to healthcare, as well as new consumer protections that were implemented by the ACH. The four main aspects are benefits for women, young adults being covered until the age of 26 under their parents' plans, different aspects that strengthen Medicare, as well as holding insurance companies accountable. They must justify if they have to increase any rates higher than 10%. My personal conclusion is that the ACA is a good law because numerous studies have shown that the ACA generated substantial, widespread improvements in protecting Americans against financial risks of illness. The coverage expansion reduced insurance rates, especially relative to earlier forecasts, improved access to care, and lowered out-of-pocket expenses. The insurance market reform also made it easier for people to get and stay enrolled in coverage and ensured that those who had insured had true financial risk protections. However, even though the ACA has been associated with improved patient experience and access and decreased out-of-pocket costs for lower income individuals, it actually showed little or no change in the quality, the utilization, and the total care of costs for all. So I do still believe that it's a good law because it ultimately did one of the biggest aspects, which is the reduction of the costs as well as the increasing of the access. As for quality, that will be time that will be needed to show what aspects of the ACA can improve on the quality side of healthcare. Thank you.